Now, our next topic of discussion is thyroiditis. What we'll discuss in this lecture is what is thyroiditis, its classifications, pathophysiology, its clinical findings, its complications, and treatment. But now, in this lecture, we only discuss what is thyroiditis, its classifications, and pathophysiology. Next, we'll discuss in part 2. Thyroiditis is a group of inflammatory disorders. It's a group of inflammatory disorders involving the thyroid gland. Its etiology range from autoimmune to infectious region. This condition is characterized by inflammation, destruction or dysfunction of thyroid follicular cells, and which can lead to either hyperthyroidism due to leakage of thyroid hormones because of inflammation to thyroid gland, hypothyroidism because of destruction of thyroid tissues, or transient biphasic pattern of both. It's caused by variety of infections, autoimmune, drug related, radiation induced, and traumatic factors. Course may be self-limited or progressive, depends upon the cause. Now let's classify thyroiditis depending upon the cause. Now its classification, it's classified into the number one, autoimmune thyroiditis. The second one is painful subacute thyroiditis. Third is infectious thyroiditis, also known as the suppurative thyroiditis. And the fourth one is IgG4 related thyroiditis, and it is also known as Riedel's thyroiditis. Again, autoimmune thyroiditis is further subdivided into the chronic lymphocytic thyroiditis, which is also known as the Hashimoto thyroiditis, and which is the most common of all. And second one is postpartum thyroiditis. The third one is painless or silent sporadic subacute thyroiditis, and the fourth one is other cause of thyroiditis. The thyroiditis is also classified into acute, subacute, or chronic thyroiditis depending upon the clinical course. The acute thyroiditis, the most important cause in this is the bacterial cause. For example, staph and strep infections, fungal infections, the aspergillosis, candida, histoplasmosis. The after radioactive iodine treatment and drug induced like amiodarone. Amiodarone may also be subacute or chronic. In subacute, most common causes viral thyroiditis, which is also known as the Decovain thyroiditis, silent or postpartum thyroiditis, drug induced like interferon or amiodarone induced. And in chronic, the thyroiditis, most common cause in chronic is the autoimmune thyroiditis, that is the Hashimoto thyroiditis and Riedel's thyroiditis. And now the pathophysiology. Let's first discuss the pathophysiology of autoimmune thyroiditis. By understanding the autoimmune thyroiditis, the autoimmune cause, it is much easier to understand the pathophysiology of other cause. The general step in pathophysiology are: there is a presence of trigger. A trigger is present which activate the immune system. That is the activation of B cells and the T helper cells. And these B cell and T helper cell cause the progressive inflammation of thyroid gland. And what would be the triggers? It could be anything. For example, genetic predisposition. For example, HLA-DR3 and DR5 association. The viral infections, drugs, for example, lithium, iodine excess, interferons, amiodarone, checkpoint inhibitors, chronic hepatitis C infections, many more. These are few triggers that activate the immune system and which cause the progressive inflammation of the thyroid gland. Now let's zoom into one specific trigger, that is excess of iodine, and to understand how it caused the thyroiditis. As thyroid gland needs iodine to make thyroid hormones, But when we take too much iodine, either from supplementation or diet or certain medications that contain the iodine, in some people, for example, people with family history of autoimmune thyroiditis, the thyroid gland absorb these extra iodine. The excess of iodine cause, number one, the increased synthesis of thyroglobulin. And with the excess of iodine, it also cause too much of iodination of this protein, that is of thyroglobulin. Normally iodine attached to the tyrosine residues to form monoiodotyrosine and diiodotyrosine in the thyroglobulins. But too much of iodine leads to over iodination of tyrosine residue. This alters the normal shape and structure of thyroglobulin. And now the immune system no longer recognize this heavily iodinated thyroglobulin as self. And secondly, with the excess of iodine, the thyroid gland has have to work harder to make hormones. This lead to increased oxidative stress, and which lead to increase the formation of harmful molecules like reactive oxygen species. And these reactive oxygen species damage the thyroid cells from inside, and these damaged cells release the internal proteins like thyroid peroxidase and altered thyroglobulins into the circulation. And normally the immune system does not see these proteins, but now it does. The immune cells think this exposed thyroid proteins are invaders. These proteins are then taken up by the APC, that is antigen presenting cell, that is dendritic cells and macrophage. The antigen presenting cells now travel to the nearby lymph node, and where it present the antigen to the CD4 T helper cells, and with the exposure of antigen the T helper cells become activated, and now these T cells activate the B cells. The activated T cells and B cells are now migrated into the thyroid gland. Here T cells cause the direct damage to the cells of thyroid gland, that is direct destruction of the thyroid follicular cells, whereas B cells start gathering in a group. It's like immune system set up a factory inside the thyroid to make more weapon against it. This group of B cells is what we called as a germinal center. Here B cells differentiated into the plasma cells and produce autoantibodies like anti-TPO antibodies, anti-TG antibodies, and these autoantibodies attract more immune cells, and which leads to a chronic inflammation. The chronic inflammation cause the destruction of thyroid follicles, loss of hormone producing cells, and repeated immune attack leads to scarring, that is fibrosis of the thyroid gland, and shrinkage of the gland, and now the thyroid becomes shrunken and underactive, and which can lead to hypothyroidism. Histopathologically, what we see is the number one, the gathering of B cells in a group just like a factory of weapon inside the thyroid gland. And this group of B cells are called the germinal center. And second, there is heavy infiltration of B cells and T cells in the thyroid gland, distorted thyroid follicular cells without the colloid. Sometimes these epithelial cells of these distorted cells become enlarged, granulated, and rich in mitochondria. These cells are known as the Hürtel cells or oxyphil cells. And at last, what we see is the fibrosis of the thyroid gland. So, in this histological image, we see germinal center, T and B cells infiltration, a distorted thyroid follicle cells without colloid, and then fibrosed tissue because of scarring. And this is the histopathological image of thyroid gland in case of thyroiditis.